Is pregnancy becoming more dangerous in America? Pregnancy is often considered one of the most natural parts of life, yet in the United States, it has become increasingly dangerous for many women. While medical science has advanced and technology is at its peak, maternal health outcomes in America are showing troubling trends. Maternal mortality rates are higher than in most other developed nations, and new challenges ranging from funding cuts for research to racial disparities are making the situation even worse. In this article, we will explore why pregnancy in America appears to be becoming more dangerous, what factors are driving the risks, and what solutions may exist to improve outcomes for mothers and babies. The state of maternal health in the U.S., according to data from the Centers for Disease Control and Prevention (CDC), the U.S. has one of the highest maternal mortality rates among developed countries. While countries like Canada, Germany, and Japan report significantly lower death rates for mothers, American women face risks that are comparable to those in less developed healthcare systems. Some key statistics. The maternal mortality rate in the U.S. has been estimated at 32.9 deaths per 100,000 live births in 2021, nearly 3 times higher than in Canada and more than 10 times higher than in some European nations. Black women in the U.S. are about 3 times more likely to die from pregnancy-related complications than white women. Many maternal deaths are considered preventable with timely medical care and adequate support. This picture raises a fundamental question. Why are American mothers at such high risk despite living in one of the wealthiest countries in the world? Why is pregnancy becoming riskier? 1. Cuts in research funding. One of the most alarming issues today is the reduction in federal funding for maternal health research. A recent report in the Washington Post highlighted that many medications in the U.S. were approved without sufficient safety testing for pregnant women. In fact, about 90% of drugs lack adequate pregnancy safety data. Without strong research investment, it becomes nearly impossible to improve medical guidance for expecting mothers. 2. Underlying health conditions. Chronic diseases such as diabetes, obesity, hypertension, and heart disease are increasingly common in the U.S. These conditions raise the risk of complications during pregnancy, including preeclampsia, gestational diabetes, and premature birth. Since lifestyle-related diseases are on the rise, more pregnant women enter pregnancy with existing health problems that put them in danger. 3. Healthcare access and costs. The U.S. healthcare system is notoriously expensive, and access is not equal for everyone. Women without health insurance, or those with limited coverage, may avoid seeking regular prenatal care due to cost concerns. Delayed or inadequate care increases the risk of complications being missed until they become life-threatening. 4. Racial and socioeconomic disparities. Maternal health outcomes in America show a stark divide along racial and economic lines. Black and indigenous women face disproportionately higher rates of maternal death and complications. Poverty, discrimination, and unequal access to quality hospitals and doctors make these disparities worse. Even highly educated black women with good insurance have been shown to face higher risks than their white counterparts, suggesting that systemic racism in healthcare plays a role. 5. Mental health and maternal mortality. Mental health is another critical but often overlooked factor. Depression, anxiety, and postpartum mental health struggles are common during and after pregnancy. In some states, mental health conditions and substance use disorders have become leading causes of maternal mortality. Without proper screening and support, these risks can turn fatal. 6. Over-medicalization versus undercare. Interestingly, American pregnancy care struggles with 2 extremes. On one hand, some women face unnecessary medical interventions such as excessive C-sections, which can increase risks. On the other, many women, especially in rural areas, lack access to obstetricians and maternal care facilities. This imbalance leaves mothers vulnerable at both ends of the spectrum. Case studies. Where the gaps show rural America. In many states, hospitals are closing their maternity wards due to cost-cutting. Women may need to travel hours to reach the nearest delivery facility, putting them at higher risk in emergencies. Urban centers. Even in big cities, overcrowded hospitals and overworked staff may miss warning signs. Cases of women not being taken seriously when reporting pain or complications have tragically led to deaths. Minority communities. Serena Williams, one of the world's most famous athletes, shared that her life was endangered during childbirth. Due to doctors initially dismissing her concerns, if someone of her status faced this, the risks for average women are even more concerning. Consequences of a dangerous trend. The dangers of pregnancy in America go beyond individual tragedies. They have ripple effects on families, communities, and the healthcare system at large. Children who lose their mothers at birth face lifelong disadvantages. Families are burdened emotionally and financially when maternal complications occur. The healthcare system ends up spending more on emergency care rather than preventive measures. This vicious cycle highlights why solving maternal health challenges must be a national priority. What can be done? While the situation looks troubling, There are concrete steps that can help reduce the risks and make pregnancy safer in America. 1. Increase federal funding for research. Dedicated funding for pregnancy-specific research is essential. More studies are needed on the safety of medications during pregnancy, effective treatments for high-risk conditions, and interventions for maternal mental health. 2. Improve access to prenatal and postnatal care. Expanding Medicaid coverage for mothers, offering affordable health insurance, and ensuring all women have access to regular checkups can make a major difference. States that have invested in expanding care have already seen improvements in maternal outcomes. 3. Tackle racial disparities. Addressing systemic racism in healthcare is non-negotiable. Implicit bias training for healthcare providers, improved accountability systems, and community-based maternal health programs can help close the gap. 4. Integrate mental health services. Pregnancy care must include mental health screenings and easy access to counseling. By addressing depression and substance abuse early, many preventable deaths can be avoided. 5. Support rural healthcare infrastructure. Investing in rural hospitals, telehealth, and mobile maternal care clinics can ensure that women in remote areas are not left behind. 6. Listen to mothers. Perhaps the simplest yet most powerful solution is ensuring that women's voices are heard. Many maternal deaths occur because early warning signs were dismissed. Training providers to take mothers seriously can save lives. Looking ahead, the role of AI and technology, emerging technologies may also play a role in making pregnancy safer. Artificial intelligence (AI) can help identify higher-risk pregnancies earlier by analyzing medical records and lifestyle data. Wearable devices can track maternal health indicators such as blood pressure, heart rate, and glucose levels in real time. Telemedicine can connect mothers in underserved areas to specialists instantly. While technology is not a silver bullet, it has the potential to reduce preventable complications. When combined with strong healthcare systems, conclusions. So, is pregnancy becoming more dangerous in America? Unfortunately, the answer is yes, but it doesn't have to stay this way. The rising risks are tied to a combination of systemic issues: research funding cuts, unequal access to care, chronic health conditions, racial disparities, and lack of attention to mental health. However, with the right policies, community support, and medical innovation, the U.S. can reverse these trends. Pregnancy should not be a life-threatening event in a country with such vast resources. Every mother deserves a safe and supported journey to bringing new life into the world.